afternoon. I'm Dr. Vinod. I'm the head of Department of Anesthesiology and Critical Care in Sri Shankara Cancer Hospital and Research Center.
Hi, I'm Dr. Manasa, working as clinical pharmacologist in Sri Shankara Cancer Hospital and Research Center.
Hi, I'm Dr. Smitha. I head the Department of Microbiology and Molecular Infectious Lab. We are celebrating World Antimicrobial Awareness Week between November 18 to 24. So every year, WHO launches this program, this Awareness Week. So this has been followed since 2014. So they come up with a theme for every year, and this year's theme is Preventing Antimicrobial Resistance Together. So first let us understand what is antibiotic, what is antimicrobial resistance, and what is this so much hype about this Awareness Week. So I'll ask my first question to Dr. Manasa. So let us know about the basics. Manasa, can you tell me what is an antibiotic, what is antimicrobial resistant, and how an organism develops antimicrobial resistance?
Antimicrobial agents are natural or synthetic substances that act against microorganisms in effectively killing them and helps in the treatment of infection. These antimicrobial agents are categorized into different groups based on the pathogen against which it primarily acts on. Antimicrobial agents are considered as humanity's most precious development, as they paved way for better living conditions in human beings. Coming to antimicrobial resistance, these are the current global threat of our times. Antimicrobial resistance are the ones in which the microorganisms or the pathogens develop resistance towards particular antibiotics over the period of time naturally. This process can be speeded up due to the misuse, overuse, or antibiotic abuse, due to which the pathogens will not effectively act against the particular antibiotics which has been given for the treatment. So what happens is this hampers our ability to treat very common infections, and this leads to disease spread and increased rate of morbidity and mortality in patients. According to the CDC's latest updates, 1.2 million people worldwide died due to antimicrobial resistance, and in 2019, 5 million people have died due to antimicrobial resistance.
Okay, so why are we so worried or concerned about this development of antimicrobial resistance? What will happen if this does not stop?
The emergence and spread of drug-resistant organisms has posed a very big threat to our community in treating very simple infections. Especially the pan-resistant and multi-drug resistant organisms are causing a lot of infections which are very difficult to be treated with the existing antibiotics which we have in the system. Currently, whatever antibiotics we have, most of the organisms have become resistant to that, and there are no new drugs in the clinical pipeline of the antibiotics, due to which judicial use of currently available antibiotics is of very high importance. Coming to another point, this antimicrobial resistance also causes a lot of cost and economical burden to patients due to increased hospital stay and requirement of intensive care and expensive medications during their stay due to very common or simple infections per se. Antibiotics are required for undergoing minor surgical procedures or major surgical procedures. Due to the development of resistance, any treatment post-operatively will be very difficult to manage by the clinicians.
Another important question which I want to ask you is, knowing the importance of PK/PD of antibiotics, so how is it going to help in treating a patient? How is it going to help in reducing the AMR burden?
So PK/PD, which means pharmacokinetics and dynamics. Pharmacokinetics involves in how the drug acts in a person's body. It involves absorption, distribution, metabolism, and excretion of drug from the body. Whereas pharmacodynamics establishes a relation between the exposure of drug and its pharmacological action in the body. Coming to PK/PD, how it is going to affect the antimicrobial resistance. So one of the strategies which we can work on in preventing antimicrobial resistance is by optimizing the dosing regimen and the exposure of antibiotic to a particular patient. So by doing PK/PD analysis, we can customize or personalize the treatment to the patient. Overexposure of particular antibiotics can lead to severe side effects and dropout from treatments. Similarly, underexposure or subtherapeutic level of particular drugs can cause emergence of resistance. By doing PK/PD analysis, we can get to know the optimum level of drug required by the particular patient and optimize their dosing regimen, frequency, and the choice of antibiotic can also be determined by doing these analysis. Sir, could you please tell me your perception on antimicrobial resistance and the concerns and challenges you face as a clinician while treating microorganisms which has already gained resistance?
Antimicrobial resistance, as we all know, is one of the most pressing problems faced by all of us today in most of the hospitals. The main reasons for antimicrobial resistance are the inappropriate use of antibiotics and perhaps helping the spread by not following adequate and appropriate hand hygiene measures and social contact measures. There are a few solutions to this antibiotic resistance, to prevent antibiotic resistance, but it requires the cooperation and the proactive behavior from all the people, including the healthcare workers, staff, nursing staff, and even the patient and their patient attenders. How does this antibiotic resistance develop? We know that these bacteria which are there, evolution-wise, they have been there for many more millennia when compared to human beings. And they have endured all the natural calamities occurring on Earth and they still are going strong. This means to say that genetically they are more adaptable and they are much more tough and strong when compared to human beings. The antibiotics were discovered say about 200 years back, and from then onwards, problem of antibiotic resistance has been there quite significantly. And this antibiotic usage against the microorganisms is just a blip on the screen of the microorganisms' evolution. They have got several mechanisms by which they can develop resistance to these antibiotics, either by gene mutation or even by developing genes which makes them resistant to the chemicals which are aimed at killing them. Presently, the concept of antimicrobial resistance is seen mainly because of inappropriate usage of antibiotics and also the spread of antibiotic resistant bugs, which are also known as superbugs amongst the hospital personnel and amongst the patients. So it is well known that bacteria develop resistance even after a single usage of antibiotic. So does it mean that we need to stop using antibiotics altogether? Definitely not. The best way to go about with using antibiotics is to give it in the right patient, at the right dose, and for the right duration of time. For this, there are several challenges. First and foremost, when a patient comes with sepsis or with some infection, we don't know which bacteria is growing inside the patient. So we need to do a culture for that. And by doing a culture, it takes about 3 to 4 days for the culture report to come. In the meanwhile, we definitely need to start some antibiotic for that patient empirically in order to control the infection. And this duration of time can be, we may be giving an appropriate antibiotic or we may not be giving an appropriate antibiotic to the bug which is there inside the patient. This will lead to some amount of resistance of the organism to the antibiotic which we are giving, and it may not be effective. Suppose we had a system by which we can detect the organism very quickly, say within a day or so, then we will be able to give the most appropriate drug to which the bacteria is sensitive. This will to some extent reduce the usage of empirical antibiotics for a few days till the culture report comes. This is one way. The second thing, the challenge which we are facing is, we get patients with several comorbidities like renal problems, hepatic problems and all those things. In these patients, we cannot give the right dosage or the maximum dosage of the antimicrobial due to the fear of worsening their comorbid condition. We may worsen their renal parameters or we may worsen their hepatic parameters. In these patients also, we will tend to give a lesser dose of these antibiotics, or even by ignorance, we may give a lesser dose of the antibiotics to the patients who are having these infections. And by giving lesser dosage, we are not only killing less number of bacteria which are there, but also we are sort of making those bacteria more resistant, enabling the bacteria to get resistant to the antibiotics which we are giving. So this is another problem or challenge which we are facing clinically. The third important thing which we are facing is the concept of hand hygiene. The hand hygiene is a most important thing by which we can prevent the spread of multi-drug resistant organisms, and it has to be followed universally, not just by the doctors or the staff nurses. Everybody, including the patient's attender and the patient, has to follow this hand hygiene so that the spread of these multi-drug organisms will be prevented. International studies also, the compliance to hand hygiene is anywhere between 75 to 85%. You won't get, even the best hospitals, you will get very modest hand hygiene compliance rates. This is because of the ignorance. It may be because of some lackadaisical attitude of either the staff or the doctors to the concept of hand hygiene. It has to become a second nature to all staff members, doctors, and patient caregivers for the prevention of multi-drug resistant organisms. The third thing is the patient surroundings, or the patient who has multi-drug resistant organisms. The surroundings have to be kept clean by repeated cleaning and mopping. This also to a great extent prevents spread of multi-drug resistant organisms. And the next thing, as I mentioned, the antibiotics which are given have to be appropriate. They have to be given in the right dose, and if possible, instead of monotherapy, if we are able to give 2 or 3 antibiotics to combat the same organism, to some extent it may reduce the incidence of drug resistance. This has not been definitively proven, but there are certain studies which say that usage of multi-drug therapy may help in reducing the antibiotic resistance. So these are the things which I feel may help in reducing antimicrobial resistance.